Dr. Jaffe, this question is about one of PERQUE's products called Sleep Guard. And Sleep Guard has tryptophan, which of course converts to serotonin. Now, is there an issue with serotonin syndrome if we take this product? And if not, why?
Well, what is serotonin syndrome? Serotonin syndrome exists only in people that have had certain kinds of medical prescriptive antidepressant therapy, especially Librium and Valium, the so-called diazepams. I am old enough to remember when they were introduced, and they were introduced as having zero side effects. You could give them in the water supply. That was what we were told, and it was wrong. So serotonin syndrome does not have to do with the serotonin that you take in our enhanced uptake, which goes to the gut and central nervous system and converts where needed and when needed to serotonin and or melatonin physiologically. Whereas serotonin syndrome is a pharmacologic side effects of pharmacology. And yes, it's not just too much serotonin. It's too much serotonin in the presence of too little adrenaline. So you've exhausted the adrenaline, but the serotonin continues to be produced because of the induction caused by the medication. So what does that mean? Taper the medication slowly, but taper the medication, and use Sleep Guard if restorative sleep is needed as part of an overall sleep correction or restorative sleep plan. And you would take the serotonin precursor, you would take the tryptophan enhanced uptake product called Sleep Guard about half an hour before you want to go to bed. And then you spend the next half hour transitioning from day to night in ways that relax and stretch and allow you to make a graceful transition to restorative sleep, which is very important. I can tell you, having spent many years when I did not get restorative sleep, and now having many years when I have restorative sleep, way better when you get restorative sleep. So Sleep Guard, not a problem for serotonin syndrome. If you have serotonin syndrome, look at the medications, look at the pharmaceuticals, and we can help you taper them and counterbalance so that you can rebuild your adrenals and your thyroid, your ovaries or testes. You can rebuild your pancreas and your liver and your gallbladder and your spleen. They can all be rebuilt, and they may need to be rebuilt if you actually have serotonin syndrome.